Hi, good morning Yannick. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 9th of January 2024. How are you doing? Well, I'm great. Can you tell me your full name, for the record please? And what is your candidate number? All right. Are you taking this test as a nurse? Okay. Can I see your ID, please? Okay. Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes. How do you ensure you remain up to date on advances in nursing? Would you say you're a team player? What do you find is the hardest part about being a nurse? How do you handle the stress of the job? Why are you leaving your current position? Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions? You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes. You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OET-speaking role play. Don't worry if I stop you when the time is up. I'm getting well and do not have any trouble with my hip replacement surgery. I am recovering well. Currently, I am feeling okay, except for these blisters on my lip. It's so annoying and painful. Yes, sure. It started yesterday. I don't know why it came back. I haven't had one in years. Well, yes. I'm worried that I got it from the hospital. So you're saying I already had this virus before? Then, how did I get it? But why did it come back now? Is it because of the surgery? I see. But what can I do about it? It hurts and it looks ugly. Okay, thank you for that advice. But will it go away completely or will it scar my lip? Alright, I got it. Will it spread to other parts of my body? I see. Thank you for explaining everything to me. You've been accommodating and kind. No, not right now. Thank you again for everything. Yes, of course. Go ahead. Alright. That is the end of your OET speaking roleplay. All the best. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.